Good afternoon, everyone. Welcome to the AVPN webinar on philanthropy's response to COVID-19 across North Asia. By way of introduction, my name is Amy and I'm the Partnerships Manager at AVPN, and we're very glad that you can join us today. First of all, I'd like to give you a brief overview of today's webinar flow. Our chairperson and CEO, Narada Batra, will be kicking off the session with a welcome address. She will then hand over to our moderator, Harvey Koh, who is the Managing Director at FSG and also board member of AVPN, who will introduce us to the topic and the speakers. Following the presentations, we will have about 20 minutes for Q&A before Harvey closes this webinar with some summarizing remarks. Please feel free to type in your questions at the bottom of the screen if you can see the Q&A button. If you have further questions that are not answered by the end of the webinar, you can email us at partnerships@avpn.asia.
A very good afternoon, dear members and participants of the webinar. As Amy mentioned, we have now more than 230 people that have already joined in. So a very warm welcome to all of you to our first webinar on the topic of COVID-19. I'm very happy that we could raise your interest and that we have so many people joining us to learn more about how these two amazing organizations have responded to the COVID crisis. We live in challenging times, and I hope all of you and your families stay safe and healthy as we manage to navigate as well as possible through the current rapidly changing circumstances. Singapore is in its first day of lockdown today, which I know many of you have been going through for a very long time. Despite all these difficulties, COVID-19 is also bringing a lot of opportunities for first movers. And I'm very proud to witness that our members are doing incredible work in this space. This work deserves attention, and therefore we want to share some of the stories with you. At AVPN, we feel that it is very important now to take collective action, to reinforce the connections we shared with one another and share stories of inspiration and learning that we can all benefit from. Not only are we therefore taking our 2020 conference fully online, but we are also organizing a series of webinars like this one to show how a wide range of stakeholders comprising grant makers, impact investors, and corporations are responding to this global pandemic effectively. This is our first webinar in this series, and I'm so glad that we could find very competent representatives from our member organizations that are happy to share their stories with us. These stories represent the experiences of our members in China and Hong Kong, where they were first hit but have since made tremendous progress. During the next hour, they will talk about the philanthropic efforts that they have undertaken to mitigate the impact of the virus and how we can continue to address upcoming challenges to reduce the post-outbreak implications. I want to thank Harvey Koh, Yanni Peng, and Leong Chung for their openness and their readiness to take on an active role in this webinar. Harvey Koh, our moderator, will introduce the speakers later. I can only say thank you once again for participating today. We will organize more of these webinars and are therefore counting on our members and our supporters from all over the world to get in touch with us for interesting stories to share. I'm confident that we can win over this crisis and rebuild a whole new, more resilient post-COVID-19 world by harnessing the power of networks. I wish you a good learning experience during this webinar and look forward to welcoming you again to another one soon. Stay safe. With this, I hand over to Harvey Koh to continue with the introductions. Harvey?
Thank you, Naina, and thank you, AVPN, for organizing this webinar. I believe we've got right now 256 participants. So good morning and good afternoon to all of you. I know we've got people actually joining not just from Asia, but also from Europe and Africa today. So I think there's a lot of interest in the experience that Yanni and Leong will speak to today from China and Hong Kong. And thank you all for making time to join. I know that This crisis is one that's been impacting most, if not all of us in some way. I'm sure you're all busy dealing with the new issues and challenges that this is throwing up. I know that certainly we are. So thank you for taking time to, from all that to join us today. As we speak, and maybe at this point we could just have the slide up, the introductory slide up. We know that this is a global crisis. It now seems, almost every day we're saying about how this is completely unprecedented, and it is. I think we're also increasingly aware that this isn't going to be a sort of short, sharp crisis, but actually something that's going to have lasting impact on the world, on our societies and on our economies. So my guess is that whilst this is our first webinar at AVPN on this topic, it probably won't be our last. And I know that many of you will have ideas about what we could continue to discuss, and that AVPN will be reaching out to try to work out what should be covered as we go on. But I think the focus for this first one, as Naina said, is natural and is right, in that we're starting with mainland China and Hong Kong. These are the places that have traveled furthest along the journey, which have been dealing with the crisis since January. The UK, where I'm calling from, really only started dealing with COVID-19 in March. Hasn't quite reached the peak of its curve yet, although in a sort of alarming turn of events, our Prime Minister was admitted into intensive care yesterday, some of you may have seen. So it really is affecting everyone. Other places like India seem to be at an earlier stage, but with very deep concerns about where things might go in the next few weeks and months. So I think it makes sense for us to start with those who have traveled the furthest distance so far. And so I'm really grateful that today we've got perspectives from Yanni in mainland China and Leong in Hong Kong to bring to all of us. Before we dive into the content, I thought it might be quite interesting to run a quick poll of all of you, which we can do just through Zoom. If I could ask the team to maybe bring up the poll. I just wanted to get a quick sense from everyone about the extent to which you've already been responding to the COVID-19 crisis. So if you could just quickly click on the button, either you've already started some initiatives in response, or that you're planning to, or if actually this doesn't really have an impact on your work at all and you're not planning to respond. Just quickly click that and we can quickly show the responses. So I think the results have come in. Right, so actually a very large number of you, 4/5 have already started responding, which is great. I think it's really heartening to see such a quick response from so many of you. And I think most of the rest of you, if you haven't already responded, you're planning to respond, which is also great. So I feel like learning today from those who've gone before, Narada and the Hong Kong Jockey Club, will really be useful for the rest of us in terms of thinking about how we can respond and work with communities and other actors in responding to the crisis. Fantastic. Great, thank you for doing that. So if we move on the next slide, before I turn to Leong and Yanni, I'd really like to start with a number of framing thoughts about how philanthropy can and should respond to the crisis. And these are actually taken from a very widely read blog that my colleague Lauren authored a couple of weeks ago, entitled 7 Ways in which Philanthropy Can Respond to the Crisis. This can be found on our website, fsg.org. And the main thing that Lauren speaks about is really that philanthropy really works to promote community and individual resiliency. How do communities and individuals use available resources to respond to and withstand and recover from these crises? It's something that we see not just in pandemics, but also in natural disasters, disaster relief, and there have been many lessons that have been learned about how philanthropy can really do that, and some of those are summarized in the article. What's interesting is that Lauren, before she worked with us in philanthropy, was really working in public health. So she's a doctor, a pediatrician, and was also medical director of the Massachusetts Department of Public Health at the time of the swine flu crisis, the H1N1 crisis in the US. And she notes in the blog that actually she knows from that experience of responding to swine flu that responses during a time of crisis are only as good as the strength of relationships and preparedness that existed before the crisis. And I think that's such an important point. I think that has implications for certainly how we respond in the crisis, because we're really using the relationships and networks and systems that we had from before. And her suggestion in the blog is that if we haven't got the right relationships with, say, local actors and stakeholders to really respond to the needs in those communities and those areas, that we actually try to work with or work through those that we know have those relationships before going in. But the other implication of that is that we should also think about how we prepare before the next crisis, so that we're not always just responding when the crisis hits. And I think we'll learn about that today in the work that Narada have been doing in China. I think while it's difficult to predict exactly when the next crisis will hit, we know for certain that they do come. They will come. And so it's important for us to prepare before they actually impact us. And then the final point I just want to highlight from Lauren's blog, which some of you may have seen if you've read it, is that any crisis of this kind, any natural disaster or public health emergency, always takes a greater toll on those groups who are marginalized or excluded before the emergency, right? These are the groups that haven't got the material resources to be able to protect them from these threats, whether that's infectious disease or a storm. And you can see this in all sorts of ways now as the crisis is playing out. Certainly plays out from a health perspective, but it's also in terms of livelihoods, in terms of personal safety, in terms of their physical well-being, their mental well-being, their access to food. There are all sorts of ways in which these things are playing out right across Asia. And so it's a really important point for those of us who are thinking about how philanthropy can respond to what's happening today. And so this is the context to which philanthropy needs to respond. And with that context, I'm now going to turn to our panelists. And I'm actually going to start with, so our two panelists today are Yanni Peng, who's CEO of the Narada Foundation, based in China, and Leong Chung, who's Executive Director of Charities and Community at the Hong Kong Jockey Club. So great to have you both with us today, and thank you for making time to share your perspectives. So I'm going to start with Leong, and what I'm going to ask the panelists to do is just to give us a quick snapshot, start with the situation that they're facing on the ground in Hong Kong and then in mainland China, and then go into the specific challenges that they've identified and how they're going to be addressing those. So Leong, I'm just going to hand over to you.
All right. Thank you, Harvey. Can I get back to the first slide first before the learnings? Right, thank you. So thanks again for your invitation and AVPN, and it's quite an honor to speak to this group of very devoted, I think, practitioners in the sector. The COVID-19, as we all know, it is very global, and it does affect people disproportionately, in terms of age, and also in terms of certain people with chronic health conditions. They will be at a greater risk. I think in the meantime, as of now, all of the governments around the world all realize social distancing is perhaps the more effective measures. Sorry, I have some. Can we go back to slide 2? the previous one. Yeah, no, next one. Okay, this is the one. Yeah. Sorry about that. So, I mean, I guess if we look around the world, all governments, Western, Eastern, North or South, now all realize social distancing is an effective mitigation measures. But of course, we all understand, particularly I think in the social services sector, a very prolonged kind of application of this measure does bring, again, disproportionately to certain vulnerable groups, the different kinds of challenge. You know, the frontline carers in elderly homes, in institutions, they face a lot of pressures, and they sometimes also feel like they're not well trained enough to deal with the current situation. Parents, you know, a lot of the schools are closed. So what do they do with their homebound children? It's also sometimes very difficult for people with chronic conditions. They have to go back to hospitals for kidney, for example. But then, you know, realizing every time they go, it seems like a risk, taking the public transportations, going into hospitals, potentially, you know, going through areas with higher chance of infection. And upcoming in the horizon, I think we can all also see potential loss of employment and income stability in quite a number of industries. So I think it is not just a virus, not just a disease per se, but it has a profound impact on a lot of different walks of life. And I think when answering Harvey's question, when the crisis, when COVID-19 first appeared, probably in a lot of the communities that we see, panic and anxiety, and a lot of mental stress. We're seeing queues, we're seeing empty shelves, people not knowing what to do, and people even hearing different sources of information. Sometimes they say wear mask, sometimes they say don't wear mask. So what do? You know, I think the panic stage was very significant. So as philanthropists, I think one of our jobs is also to think about how we then bring hope to the community, to people. I think many sectors are doing what they can. You have the government, businesses, civil society, healthcare sector for sure, and the community themselves. You know, I think you know, people need also to be resilient on their own, that we can fight this together. So I guess the key thing then is for philanthropists, what would be our role, and how do we also work with these different sets of partners to sort of to try to help solve the problem together. At the Hong Kong Jockey Club, since sorry, can we go back one slide? Yeah, thank you. Since end of January and sort of beginning of February, we have really broadly done three things. You know, I think one is agility. So respond very quickly to meet community needs. We very quickly distributed close to $7 million and through almost 100 different NGOs to deliver care packs and anti-epidemic packs for specific vulnerable groups. We also leverage our own corporate resources to directly secure and procure close to 700,000 surgical masks and also hundreds of thousands of hand sanitizers and distribute that to people. I think secondly is empowerment. So through the process in the last 7-8 weeks, we have now actually empowered over 200 partners to empower them to build social cohesion. Here we have committed $13 million, and out of the 13 million commitment, about 10 million already been dispersed, are already in the hands of our partners, so that they can, a lot of them grassroots NGOs, and they can be very sort of offering very practical solutions to their neighborhood. Last but not least is really then to collaborate, right? To convene different sectors and try to come up with creative solutions for the community. Right, so one of them would be in Hong Kong, whereby students are now, they have to learn from home through online mediums. But then we discovered a lot of the underprivileged kids, they might not have broadband, they might not have enough data plan. So we worked together with the mobile carriers and also NGOs to be able to offer to 100,000 students from 700 schools these data plans until mid-July, so they can cover, their academic year this year. So these are kind of the things that we have done, and we really derive 6 learnings from these work. Number one, I think it's really speed, definitely over perfection. In this environment, when it comes to speed, we also need to think about how do we bring about speed in our own internal process in terms of decision making, in the application processing, and in fund disbursement. Like I said, this is very different from anything we have ever done before. Our usual funding for normal application could run 3 to 6 months. On this particular incident, our end-to-end, so from initial requests to fund in the NGO's bank is roughly 10 to 14 days. So you really have to innovate yourself and to be able to deliver speed and flexibility. But in this kind of time, we believe speed is of the utmost importance. Next is really, again, about empowerment. Like I said, in this crisis, we have worked with over 200 organizations in the last 8 weeks. A lot of them are first-time grantees. We don't know them before, and they come forward because we offer this fund for application. And they come back with actually some very, very creative and very practical solutions to their neighborhood. So for example, some residents in subdivided housing, we have this project which go out and help them improve home sewage so that it would reduce the chance of infection in their very small subdivided housing units. So it really, we have to trust our partners so that they can be creative and they can be flexible and offering feasible solutions. And in the meantime, it's not just the COVID-19 partners or sort of responding partners that we need to take care. The first thing we did was also we reached out to almost all of our existing partners, covering about 400 active project grantees. We call them, we ask them what they need, and we also try to give them some comfort and flexibility in handling budget. Because we all know schools are closed, a lot of the social services centers are closed. So they might not even, they got our funding, but they might not be able to deliver the promised KPI. So we need to give them this leeway and tell them, we are here with you, we are your partners. So that's also a part of the empowerment. I think the third lesson that we want to share is thinking beyond money. Right? It's money, it's for materials, for masks and everything, but it's also about online learning. It's also about mental wellness over this period of time. Interesting WhatsApp stickers, interesting videos that would teach school children how to wash their hands, and also disseminating accurate information. Right? We have a small percentage of ethnic minorities in Hong Kong. They probably speak Urdu, they probably speak Nepalese, but then most of the official announcement will be in Chinese and English only. So how do we also timely translate these messages for them? So really think also beyond money. The fourth lesson that we learn is also this is beyond money, but also about leveraging corporate expertise and network. In the time back to February, I think some countries or cities might be facing similar challenge now is even you have the money, where do you buy masks? Where do you buy hand sanitizers? Sometimes we ran into a situation whereby we pay the deposit and the other side vanish, or the other side said, the goods, they stuck in custom, they cannot be exported. So it really takes a lot of corporate resources just to solve these very practical logistics issues. So as much as possible, I think, again, in addition to money, how do we leverage whatever we have, whatever resource that we have? In the Hong Kong Jockey Club's case, we're fortunate that we have a corporate setup so we can leverage our strategic procurement to help us procure these things. So the last two is both about thinking beyond, right? Think longer term. So to us, now I think we're on second wave hit in Hong Kong of the coronavirus. So we still stay very, very vigilant about, protecting the community, about building community resilience on a day-to-day basis. But in the meantime, we start to see some other challenges emerge. A lot of the smaller size nonprofit organizations, they start to have financial distress as their service income and donation drop. So are there any programs that we can support them so that we can maintain sector diversity and we can maintain the vitality of the sector after this crisis? Similarly, as school close, some schools are very good in delivering online content. The teachers are very adept to it, but some schools might not be as adapted to it as others. So how can we do something that will help all schools elevate their standard? And similarly, with the interruption of certain social services, how do we even then use this opportunity, right, to get more technology into the sector, to transform a little bit more services so that at least they can be turned into home-based social services. So these are the set of things that we're thinking now in our mind. I think the last lesson I'd like to share, our own experience, is also we need to start thinking about even longer term. Are there any institutions, is there any particular infrastructure that we want to build, even for future shocks? I think many public health experts start to say, yes, this is a global epidemic, but it won't be the last. We will live with COVID-19 for a long time, and even afterwards, we might hit another one a few years down the road. So how do we then build institutions, infrastructures to then make our overall city or our overall community even more resilient? How do we strengthen media literacy so that fake news can be, in some sense, defended in this world of social media? It's very easy to get people panic. So how do we invest in those areas so that when crisis time comes, we will stay better together as a community? Last but not least is how do we leverage technology to help us, right? Not just to make fast money and thinking about IPO, but to help us in big data, in technology platform that will support, again, the community resilience in the long term. Right? So I think that's all I would try to share today. Right? Thank you.
Thank you so much, Leon. A lot to take in there and so much to dig into. In the interest of time, I'm going to suggest that we turn to Yanni and to get her presentation, and then maybe we can come back and dig into some of the questions that we've got for both of you. Yanni, please go ahead.
Yeah. Yes. Hi, everyone. Nice to meet you here and to talk about the response of Chinese social sector to the COVID-19. I can't see the slides here. Is it on? Is the slide on? Okay.
Give us a couple of minutes while we get your slides up.
Okay. So after listening to Leon's sharing, I think there are quite a lot of similarities between Hong Kong and mainland China. So let's move to next page. Hi, Roshni, can you go to the next page. I think first we will look at the figure, the numbers of the coronavirus situation in China. Now, so the latest data is by the 24 on the 5th of April. There are 81,000 total confirmed cases, and majority of them have already cured. And we have over 3,000 deaths in mainland China. And you see in the map, the darker means that they have more confirmed cases. And if you look at the right-hand side is the number of new cases. So you see there is one big jump in the middle of February. That is because before that there are a lot of cases, and the medical system in Wuhan was overwhelmed. But in early February, there are a lot of medical staff coming from all over China from other provinces to Wuhan, Hubei, and so starting from early February, every case in the Wuhan must be checked and must be taken into hospital. So we see a big jump in around 12th of February. Next page, please. Yeah. Next. And so apart from the infected, actually the vulnerable groups are. Can we go back to the? Sorry, go back to last. The vulnerable groups, yeah, they are more how to say affected by the virus, and it's quite similar with what Liang shared just now. And I can give a few examples. For example, the people with intellectual with IDD, they have met more difficulty when the transportation was shut down, and some of the families were taken into quarantine, and so they need more support. And we have this one example of one NGO named Inclusion China. They have established an emergency support networks across China, consisting of 287 NGOs or parents groups to provide support to those people, and for example to go to their door to give more support to the kids. And another one example is the pregnant woman. You know, in Hubei, because the transportation was disrupted, and they have a lot of difficulties in terms of getting to the hospital when they need to deliver their babies. So we have this one volunteer group, NCP Yun Network. They provide online counseling and all kinds of support, and also provide transportation services to those pregnant women. Another issue is the domestic violence. You know, in China we have this. In Hubei province, it's already over 2 months lockdown, and the families, they need to stay together. Actually, maybe a lot of families, they haven't been stay for such a long time. You know, daily you go to work a day and day and come back, maybe stay only 12 hours with each other. But after the virus COVID-19, you have to stay with your family 24 hours, and for 6 days. There are more and more domestic violence cases reported. We have this one Zero Domestic Violence NGO. They help with case reporting to the police and provide a lot of support to the victims of domestic violence. And another example is the beekeepers. In Hubei province, there are a lot of beekeepers, but it's early spring. The bees need to be moved from one province to another province to chase the blooms. But because of the transportation disruption, the bees cannot be moved to another areas. Some of these are starved, and we have a foundation, China Biodiversity Conservation and Green Development Foundation. They have done a lot of policy advocacy. So in the end, so after a few days, the central government has issued a policy paper to include this be keepers into this green channel of transportation, so they can have their bees to be moved between provinces and between cities. So next slide, please. And if we look at all the responses, then all the responses and actions, they are actually mainly in the 8 aspects. The first is the donation. There are a lot of cash donate, and also a lot of supplies, including masks, ventilators, disinfectant, liquid, a lot of things, hygienic supplies, etc. And also we need arrange the emergency logistics. If you look at the picture on the right hand, upper right, is the special truck arranged to provide transportation for the disinfectant liquid, because you need to spend special design trucks to do so. And we have NGOs working on psychological assistance, support to vulnerable people. And if you see the picture on the left below side, is the volunteer who's providing masks to sanitation workers in Shanghai. Actually, is an action initiative of middle school students. They have done this in a lot of cities in China. And the picture right hand side is the social workers to provide vegetables, food to elderly people staying at home. The elderly people, especially those who stay living alone, because they don't know how to buy, how to do shopping online, so they need more support. And we have also NGOs working on volunteer management and capacity building, and also sector-wide coordination and collaboration. Next page, please. This is the statistic of the cash donation from domestic and donors. You can see that we have a surge of donations for COVID-19, and within 2 months, we have there are about $4.5 billion donations in cash, and for the first billion, it took 7 days, 6 days, and second billion is 7 days, and the third and fourth is about 13 days. And the donor profiles that the majority of the donation come from companies, corporations, is about 72%, and 23% are from individuals. All the individual donations are mainly from the online fundraising platform, and we have 20 official online fundraising platforms. They were given license by the Ministry of Civil Affairs. So by the 2nd March, the total online donation is about $211 million from around 30 million people. So basically, its average donation from every people or every person is around $7 US. And if you compare this, the figure of the donation to the average annual donation in China, you see that's it's very big. The average donation for China in the past year, in 2018, 2017, is all about 100 billion RMB, which is around 15 billion US dollars. And you see that only for the 60 days is already 4.5 billion. It's almost 1/3 of the annual donation in normal time. Next page, please. And for Narada Foundation, we decided to respond to the COVID-19 on, I think it's around the Chinese New Year. So on the Chinese New Year Eve, our team started discussions with our grantees and partners. In China, we have this disaster relief coordination group, and which was established in 2013 when the Ya'an earthquake happened. It's a Ya'an in Sichuan province. And 5 foundations, including Narada Foundation, One Foundation, China Poverty Alleviation Foundation, Amity Foundation, and the Merchants Foundation. We jointly launched this coordination group in order to have more collaborations between the foundations when we do the disaster relief work. So we had the coordination group had a teleconference on the Chinese New Year Eve, and we discussed whether we should act on this. After a few days, we decided to launch the China NGO Consortium for COVID-19. That was established on 2nd of February. So that's a very big part of our Narada Foundation's response to the COVID-19. Another aspect is to give direct grant making. We give small grants to about 11 NGOs in 11 provinces to support them to do their frontline works. You know, in China, when there are a lot of donations coming to the NGOs, but mainly the donations are for the activities to support the end users or to give supplies. But very little was to provide general operating cost. So we decided to subsidize these NGOs operating general operation costs. The third aspect is to provide more flexible support. We talked to our grantees, and a few grantees came to us to ask whether they can use our grant to work on this COVID-19. The grant was given in previous years, but they are still in the process of using the grant. But when they have the COVID-19, they have to respond very quickly, and they don't have enough cash to support their daily work. So we agreed them to redirect our grant to support their response to the COVID-19. Next page, please. I will give more instruction about this China NGO Consortium for COVID-19. It is a joint effort of the sector in China. The main purpose for the CNC COVID-19 is to coordinate the Chinese philanthropy and NGOs in synergetic response to this pandemic. The CNC COVID-19 mainly work in 4 domains. Well, one is to share information of domestic NGOs response. The second one is to mobilize more funding. The third one is capacity building to frontline NGOs. And the fourth domain is to aggregate the technical knowledge of international expertise. Our long-term goal is to establish a coordinated mechanism for disaster relief and also strengthen the capacity of Chinese philanthropy and NGOs in emergency management. So we hope that with this mechanism, we can be more well prepared for the emergency. In the past 2 months, in February and March, the COVID-19 CNC for COVID-19 has published 27 briefings of responses, which include all the response of our members' actions. And we have published 64 articles and reports, including different topics from volunteer management to emergency logistics to support to voluntary vulnerable groups, etc. And also we organize webinars. We have 17 webinars and virtual trainings, and the total audience is over 2,000 persons. And through these webinars and the virtual training, that really helpful. For example, for foundations, we need to know what's happening on the ground, but because the lockdown, the shutdown, we cannot go to the field. We need to talk to the NGOs in the field to know about the needs. So we have this kind of webinars to talk to the frontline NGOs to collect needs, and then which will inform us in our future for our future actions. And the 6-7 members of the CNC for COVID-19 include the co-founders and issue-focused organizations, and some national and local hubs, local networks, and we have really a wide coverage of the, geographically. For example, we cover 17 provinces, and so we can know what are the situations in the 17 provinces and what are the NGOs working on in those 17 provinces. Next page, please. Next page. Okay, sorry, I'll be quick. This is just a working plan for the CNC COVID-19. We've already finished our emergency response period work. Now we are moving to the transitional reconstruction period work. And next one. In the end, I will sharing the learnings and what we are going to do in the next stage. And this is quite similar to Liang's sharing, actually. We have 5 key learnings. First is that we find that this systemic coordination between the social sector and government, as well as within the social sector, is very, very important. And we need to raise more resources for disaster preparedness and mitigation in addition to this disaster relief. And NGOs' professionalism is a must. You know, when you respond to this kind of crisis, you need your the NGOs must be very professional. They need to work with different sectors. For example, they need to work with hospitals, they need to work with community workers. And the one key issue is how to reach the last mile, especially during this transportation disruption. If you don't have the people working on the ground, you cannot get things done. So we need to invest in this local philanthropy ecosystem building. And also similar to Liang's sharing, the grassroots NGO is going to face with financial difficulties. And for the grant makers, we need to provide more unrestricted funding and flexible support to them. For Narada Foundation, our next stage actions will be on 2 aspects. First is to support the long-term coordination mechanism building. The second one is that we are going to joint launch a co-funding project with a few other foundations, mainly to support grassroots NGOs work in Hubei province, because Hubei is hit the worst by this COVID-19. And to share with my to end my presentation, I think I want to share that as a member of the philanthropy sector, I think we can win over this crisis together. We need to coordinate with each other and also more coordination between our countries. Thank you. So I hand this back to Javi.
Thank you so much, Yanni. Lots of great material there, and thank you all for sending in questions. We've got some fantastic questions. Because we've got limited time, I'm just going to maybe pull out a few questions and throw them all at once to our 2 panelists, and then get them to respond in turn to those questions. So one great question that came in was this question of how do we balance sort of the near-term response, the immediate response to the crisis, the needs in the crisis, and the longer-term response and needs that are going to be coming up over time. And I think even between, Yanni, between what you and Yong were saying, there seem to be some differences. It'd be interesting to hear about that. There was an interesting question also about partnering with government. To what extent was there a sort of partnership with government? Obviously, government actions are very much sort of central in terms of managing the pandemic and the response. So it'd be great to hear about that. And then the third question that I'll just throw in there, a very practical question that came up about how we can really move fast. So I think, Leong, you'd said it's speed over perfection. But one of the interesting questions that came in was, practically, how does that work? How do you actually go through your due diligence process, or did you have to change that in order to move quickly? Did you change the way you do your impact frameworks in order to move quickly? So balancing near and long-term response, any partnering with government, and practically, how do we move fast? So maybe, Yanni, let's start with you, and then we'll move on to Leong. Yanni, are you there? Yanni, you're on mute.
Okay. Yeah, I think the balancing the near and long-term response, really it depends on who you are and what's your advantage and disadvantage as an organization. For example, for Narada Foundation, we didn't do any work related to supplies and equipment. Because we don't have any expertise, we are not specialized in those areas, and we are and also the amount of funding is not our advantage. We in China, I think the size of our funding is in the middle range. It's not, we don't have if we compare to some other foundations, they have bigger budgets. But our strength is I think it's our convening power within the sector in China. So we initiate this CNC COVID-19 with a few partners in the very beginning. And so basically it depends on your organization's advantage and disadvantage. Yeah, that's my answer to this question.
Great, thanks, Yanni.
Okay.
So for the Hong Kong Jockey Club Charities Trust, we're the largest foundation in Hong Kong. So we donate about $500 million equivalent on an annual basis. So to us, like Yanni said, it's very different. So to us, I think first of all, it's short term, because without short term, we can't think of long term. So you have to survive this crisis first, right? And then you can think about long term. But I think the balance would be, even when you try to go out and solve the short term, I think if you have some long-term perspective, it will also help you when you design the short-term programs, or when you help the short-term courses. But again, very importantly, we are in philanthropy. When people need help now, then I think it is a responsibility that we provide help. Instead of asking sort of too ideal some questions about system change. This is not the time to ask about system change. It kind of also, I guess, if I may just answer the other two questions as well. I think on government side, we try to also work closely with the government. Of course, realizing that they are all very busy right now. The whole government cabinets, everyone, they have a lot of problems at hand. So we're not taking it as they are, they have to answer to us, and everything. But as much as possible, we try to share information with them so that, we don't duplicate each other's effort. For example, I think a question in the list also asked about the program that we give out data cards to students, to 100,000 students. Now on that program, we, I text the Secretary of Education multiple times. He got on phone with me a couple of times. So we talk about that a little bit. I said, well, we want to do this. Do you think it's a good idea? Right? And he said, okay, let me talk to my guys and then come back to you. And then after a couple of rounds, we all realized, okay, government is doing something, but not this thing. Right? And then we realized this is actually a demand. So what they then help us is to say, okay, you guys put up the money, you talk to the business sector, so you get the good deal. You talk to the NGO so that there is a distribution channel that could be set up. But the government, they help us inform all the 1,000 schools. right? So instead of us knocking on everyone's door or doing an advertisement, the Secretary of Education, he issued basically a letter to all the school principals and say, hey, pay attention, okay, next week, this program is coming. If you want to sign up, you better, do this and that. So that's been very, very helpful. So I think that's how we work with government, appreciating their limited bandwidth at the time, but then trying to share information and not duplicate efforts. I guess being fast, it is about, again, very different from how we used to do grant making. I think to be able to act very fast, of course, we benefited from our very long-term relationship with a lot of NGOs in town. So we know them quite well. Right? And that helps you to be able to move fast as well, because they're not strangers. I think the other side is when we design the program, we try to make each grant smaller in size. So in Hong Kong's context, we're making each grant maximum 500,000 Hong Kong dollar, right? So you limit your risk. And then we also be very specific and say, this is a crisis reaction fund. So we support NGOs, they do sort of three things. As long as you fall within these three things with a good argument, and we know your organization that you operate in the environment, we will make the grant to you very quickly, right? Money first. And then we'll ask for receipt and other reports subsequently. So we realize potentially we might have some miss and hits, but on the overall scheme of things, it will really empower NGOs with hope, and hopefully that would bring them to the vulnerable groups. But then we try to minimize the risk by size of the donation, our relationship with the NGOs, and then really subsequent due diligence that we will have afterwards.
Great, thank you, Leong. Great answers to those questions. I think there are so many more questions here. I wish we had another hour to go into them, but unfortunately we haven't. So we might just need to wrap up. I'm being told we need to wrap up. I think for me, in addition to all the, points that we talked about in terms of thinking about vulnerable groups and responding to needs and sort of near and long term, there's a very interesting theme that's come out here from both of you about, I think, understanding who else is doing what against which needs, right? And figuring out where you have your advantage, as it were. What is the thing that you can most usefully contribute alongside others, and then working in an appropriate way. And I think, Yanni, your point about, sometimes it's not the money, maybe it's convening, or maybe, Leong, it's working with the private sector to get some of these initiatives going. So really interesting and useful point, I think, for all of us to bear in mind as we go into thinking about the response, as many of you are. So thank you very much. I'm going to hand over, I think, now to the AVPN team to just close us out. But thank you all for spending time with us, and I hope to continue this at some later date, based on the questions that you have. Just going to hand over to Amy.
Thanks. Thank you, everyone, for your participation in this insightful session. That's all the time we have, unfortunately. What we will do is we will send the recording of this webinar to our participants next week. Thank you also to Harvey, Yanni, and Leong for sharing your experiences with us. So as the Global Community for Investors for Impact, AVPN is also working together with the African Venture Philanthropy Alliance, the European Venture Philanthropy Association, the International Venture Philanthropy Center to share lessons from across the world. These short webinars will share examples from differing regions to similar challenges related to the COVID-19, so please look out for it on our event calendar. Before we end, I would also like to share the following avenues for you to continue your engagement with AVPN. We have just recently launched our COVID-19 platform to aggregate and scale our members' efforts so you can identify needs in Asia and take concrete action to supply your resources to fill these gaps. We would also like to invite the wider AVPN network to contribute to your COVID-19 initiatives and support communities on the ground. Please also get your tickets for the AVPN 2020 conference, which is now happening virtually from 8 to 12 June. Join thought leaders, experts, and practitioners to assess the fast-changing social investment landscape and move capital effectively towards impact. Networks have never been more powerful than they are now, as we step up to support the communities that need us the most. On that note, thank you, stay safe and be healthy. We look forward to seeing you at our next webinar.